because let's be real, this isn't the first time that aid has been cut like this, and it probably won't be the last time.
This is the taxpayers' money. People have said, like, we are working hard and we don't even have, we're struggling in our own countries, let alone trying to help other people in their countries.
Yeah. And when we look at how these countries became so dependent on AIDS, it is because you colonized them. It is because you got on your boats.
Oh, no one asked you to.
Sailed the seas.
No one asked you to do that.
The choppy seas.
Oh.
Some people didn't even make it across the sea. But you made it and you said, we'll colonize, we'll claim this land, and we'll take all their resources.
Hello, Globies. Welcome to the World Health Investigation Podcast. My name is Jocelyn.
I'm Edna. We are young global health professionals and your hosts for the World Health Investigation Podcast.
Also known as the WHI, we will be discussing all things global health, unpacking the most controversial health and social issues,
as well as promoting new wave global health development and equity.
So, Miss Adina, what's the tea in global health today? Okay, Globies, now what's in the news this week? For World Mental Health Day, we need to talk about something that rarely makes the front page. The mental health of the people holding our health systems together. We talk about mental health all the time, but it's rarely ever about the people who take care of us. Our doctors, our nurses, our midwives, dentists, occupational therapists, along with every allied health professional such as radiographers, dietitians, paramedics, and more. Please be kind to them and look out for them. Now here's the tea. Across Europe, doctors and nurses are hitting their breaking point. A new World Health Organization Europe survey of over 90,000 health workers has revealed a crisis that's both heartbreaking and deeply systemic. 1 in 3 report symptoms of anxiety and depression. 1 in 10 say they've had suicidal thoughts in just the past 2 weeks. And nearly a third are thinking about leaving the profession entirely. These aren't isolated numbers. They're a collective cry from a workforce that's been stretched way too thin for way too long. And after years of chronic underfunding, pandemic trauma, staff shortages, and unsafe working conditions, Europe's healers are burning out. One nurse told the WHO researchers she works 14-hour shifts, gets yelled at by patients, and still feels guilty taking a break. Imagine being trained to save lives, but unable to protect your own peace. And here's the ripple effect. When doctors and nurses collapse, entire health systems do too. The WHO warns that Europe could face a shortage of nearly 1 million health workers by 2030 if this continues. That's not just a crisis for healthcare, that's a crisis for humanity. Now zoom out. This isn't just Europe's problem. According to the World Health Organization's mental health fact sheet, more than 1 billion people are living with a mental health condition right now as we speak. Depression is one of the leading causes of disability worldwide, and suicide is among the top causes of death for young people. Yet, 75% of people in low and middle income countries get no treatment at all. And here's the kicker. Most of these conditions are treatable with low-cost interventions like counseling, community-based care, early support. But mental health budgets are still less than 2% of health spending globally. That's not neglect, that's a choice. So, on World Mental Health Day, the host's message is crystal clear. Mental health is not a luxury, it's a human right. We can't build healthy societies on the backs of burnt out workers. We can't preach resilience while ignoring unsafe systems. And we can't keep calling people heroes if we're not giving them the help they need to heal. So, Globies, today's reminder is simple but powerful. The healers need healing too. Let's start treating mental health care as essential infrastructure, not just a nice to have. Because you can't pour from an empty cup, even if that cup wears scrubs. Now, that's your mental health day tea. Stay kind, stay curious. Remember, real care starts with care for the carers.
But also, before we get into it, a moment for the hair.
Oh,
A moment for the hair.
Thank you,
A moment for the
girl.
bayangs.
The bayangs.
The bayangs.
Thank you. Says you with the sister locks.
Oh, thank you.
The twisting.
Thank you.
Twisting our faces.
Oh,
Twisting our necks.
Stop it now. Stop it now. I'm just trying to get like you.
The summer, the skin is out. Come on.
Yeah, we're trying.
Now on to this juiciest part of the episode. What are we talking about today?
Today, we are talking about global health's latest enemy of progress, number one. Donald Trump.
Donald Trump.
Donny J.
Donald T.
Do you know Donny? Do you know Donny?
You know Donny? Well, it's been about 8 months since Donald Trump and his administration snatched everyone's funding. So we wanted to dive into how this even happened, what has been the impact, and what does this mean for global health?
And yeah, we also just wanted to share our thoughts and our take on this because, like, low-key, was Donald Trump kind of justified in cutting aid?
Was he?
Was he? A little bit?
I know he's a little controversial, but let's try and reason things.
You know, there must be a reason.
There must be a reason, right?
Yeah. So let's get into it. Because what I imagine happened is Donald Trump just woke up one morning and he just chose violence. He said WHO, global health, it's a wrap. He said anyone working in foreign aid right now, to the back immediately.
What do you mean it's a wrap?
Immediately.
What do you mean? Like just like that?
Just like that.
Just one man.
He said goodbye.
One president. You know, Americans, that's your president. I'm sorry.
Claimed him.
So yeah, on the 20th of January 2025, the US announced it's officially cutting ties with the World Health Organization, the WHO.
In fact, in their official statement from the White House, I quote, "The United States noticed its withdrawal from the WHO in 2020 due to the organization's mishandling of the COVID-19 pandemic that arose out of Wuhan, China, and other global health crises. In addition, the WHO continues to demand unfairly onerous payments from the United States, far out of proportion with other countries' assessed payments."
Side comment, has things ever been the same since COVID? They didn't stop here. In fact, they added China and said China, with a population of 1.4 billion, has 300% more of a population than the US, but yet contributes to less than 90% to foreign aid.
They basically said, WHO, your response to COVID, a flop. China has 1.4 billion people, but pays 90% less. The math is not mathing.
It's not mathing.
So y'all just need to go find another sugar daddy to fund all your activities.
Not the sugar daddy allegations.
He's done.
He was the sugar daddy. And y'all, the mess didn't stop there. The same day, mind you, the same day, the US dropped a 90-day freeze on all foreign aid. Excuse me?
All aid, every single program.
Yeah. From HIV treatment to maternal care to humanitarian aid in conflict zones, everything suddenly under what we call review.
Anyone that benefited from that aid was basically told, you've been eliminated from the donor budget. Please pack your little theories of change, implementation strategies, your health outcomes, and go.
Not the little theories of change. Said that was fun. But on the real though, for many communities like across the world, this is a freeze that could have meant life or death. A lot of chaos ensued after the Trump administration's announcement.
By the end of February 2025, 10,000 programs that were directly or indirectly funded by the US government were terminated.
And one of the largest hits by the aid cuts was PEPFAR, or the President's Emergency Plan for AIDS Relief. And PEPFAR is the largest commitment by any country ever to address a single disease. It was established back in 2003, and it's estimated that it has saved 26 million lives and prevented millions of HIV acquisitions in more than 50 countries.
So, for example, in Lesotho, Eswatini, Tanzania, a program supporting more than 350,000 people in HIV treatment was terminated.
And not just in those areas, we also have Bangladesh. It was estimated that 600,000 women and children would lose access to critical maternal health care, protection from violence, reproductive health services, and other life saving care.
And even here in Europe, a cash transfer program in Ukraine that reached 1 million people in 2024 was completely suspended.
And the ripple effects ain't just stop there. We have UN agencies that have been slashing jobs left and right and center. UNAIDS, for example, announced that it was reducing its Geneva head office staff from 127 to just 19 employees.
19.
19.
And the cuts didn't just hurt the groups that lost to US funding.
Yeah.
There were some who were lucky and were able to keep their funding, but there was a cost.
Yeah, and take the Stop TB partnership, for example. They're still getting US money, but here's the catch: they can't spend it on anything related to diversity, equity, inclusion, or advocacy.
And this means they've actually had to lay off staff working on those areas, which is so crazy.
That's
to me.
crazy.
Your whole DI office are gone. So if you're anything like us, you may have started to wonder, like, how do we even get here?
Yeah.
How does one country manage to drag the whole international development community by the eyelashes?
Not by the eyelashes.
The thinnest of
The,
eyelashes.
the eyelashes that are flying.
Yeah.
So before we dig into all our thoughts on this, we thought we might give you a little crash course, okay, on global health financing and how exactly this has been going on and how we're getting involved.
Yeah. Because obviously the US has been funding global health for a long time.
Yeah.
So let's how do we begin? Let's paint a picture, right? In your head, just try to imagine global health funding like a giant fragile Jenga tower. And you've got countries stacking, programs, money, and partnerships on top of each other, all to keep it from collapsing. And then the US comes in,
walks in and decides to pull out one really big block, like the biggest block, like the one everyone's been pretending isn't load bearing.
because listen, Donald Trump and his administration, they can lie about many things that they can do. But one thing they didn't lie about is that the US is the biggest donor. We're talking about 12.4 billion in 2025, which sounds huge, but is also actually less than 1% of the US's federal budget.
They got that money. Give me that money.
That's money.
And they spend that money in two ways. First, we have the bilateral funding. That's where they directly support programs in almost like 80 countries and like literally saying some cash. Here you go. Here's some cash. You can go run your little malaria program or whatever.
Whatever. And then we also have multilateral funding. That's when the US pulls money into big global health organizations like WHO, UNICEF, Gavi, Global Fund, kind of like putting money into a group project. But I guess in this case, the group project actually saves like millions of lives.
Oh, that's a nice group project. And historically, the US has loved to be the star player, the main character energy, like we mentioned earlier. They led the creation of PEPFAR back in 2003 and the biggest ever lateral program for a single disease aimed at HIV and AIDS.
But that leadership also created extreme dependence, especially for a lot of African countries, which is fine when the money was flowing and your sugar daddy was happy,
Yeah.
But then,
When the US cuts funding or just threatens to, we have whole systems that start to get a little shaky.
and actually, it's not just the US that's been cutting funding. Other big donors like the UK, Germany, France have also announced cuts to aid. So OECD actually estimates that official development assistance for health could drop up to 33% in 2025 compared to what it was 2 years ago.
That's a huge hit for low income countries, especially African countries, which get 84% of US bilateral global health funds. You can't just replace that overnight.
Impossible. So the bottom line is when a country as big as the US just sneezes, they just make a movement. The whole of global health feels it.
Basically, the whole system is fragile because it's built on a small number of massive funders. When one of them pulls out or even just trims their budget, it sends shock waves that can take years to recover from.
Right. Okay. So that was a very quick tour of all the chaos that has been global health in the past few months. So I just want to pause here. Let's just take a moment. I wanted to get Justin's thoughts.
Oh.
Share our thoughts
Well,
on everything that's been going on.
Okay, but you're putting me on the
Um,
spot.
Of course.
Yeah.
So let's get into it. So, my first question, I guess, let's just take it back to January 2025.
Yeah.
When this news broke out. What were your reactions? What were your thoughts?
My real thoughts?
Your real thoughts.
I'm not gonna lie, I was shocked.
Mm.
I was shocked. Like, excuse me.
I beg your pardon.
I beg your pardon. Global health. I'm a global health girly. First of all, let me just say that I'm a global health girly. I've always wanted to be in global, not always, but I love global health. I'm passionate about global health. So when you're telling me that, we've always known that health, the industry, I'll call it an industry for today's purpose. The healthcare industry or whatnot, it's meant to be an industry that is pretty much safe when it comes to jobs, or even budgeting. You would think that there's no price to money, there's no price to health. Sorry.
Yeah.
So when I hear that they're cutting funding for basic healthcare needs across the world, I was like, wait a minute.
Wait a minute.
What happened to universal health coverage? What happened to not leaving anyone behind? What happened to individuals being at the forefront? But then I'm thinking it was never really about the individual. It has been a political move, if I may say, maybe even a power move. Yeah, so it's a shaky time for global health.
Yeah, for the globies. I see where you're coming from. Definitely, you would think it is about the individuals and focusing on improving people's health. But I have to say, when this news broke out, I was very much kind of like, well, this was always an option. This was always something that could happen.
Yeah.
And so part of me was just kind of like, yeah, whether it's Donald Trump or anyone else, a lot of these governments who give foreign aid, they can at any moment just kind of decide to take that aid away, and you can't really do much because it's their money.
It's their money.
It's their money at the end of the day. I think the part that shocked me the most was how sudden it was.
Yeah.
And I just think, it would have been much better or a different scenario if they came out with an announcement like, listen, in 20 years, there will be no more PEPFAR, there will be no more US aid. So start sorting out your monies now. Like, start figuring yourselves out. Like, the money isn't just going to completely go right now, but eventually we're going to cut it down. That would have been better. It was just too much too sudden, in my opinion.
Too sudden. And bear in mind, a lot of the sustainable development goals or international development goals are future oriented. We have the 2030 goals,
Soon.
soon. But then again, it goes back to my point earlier about, was it ever really about Donald Trump doing this in a way that is also considerable of others in these countries? I mean, he has referred to these countries as, excuse my language, shithole countries in the past. So I don't think he values the foreign aid that goes to these countries. It's a political move. It's a power move. It's a way to say, I've got the power and I can change all of y'all overnight if I want to.
Yeah. A little reminder for everyone, basically, to be like, yeah, we can exercise these rights. And they did.
Yeah.
And they did. So do you think in a way they were justified in doing that? Do you think Donald Trump was justified, or is any country ever justified in cutting their aid?
That's a good question. And like, the global health in me would automatically think, oh yeah, no, like, it's not justified. It's inconsiderate, blah blah blah, which I get, but I can understand arguments from both sides.
Yeah.
On one hand, I've heard the Americans say, this is the taxpayers' money. People have said, like, we are working hard and we're struggling in our own countries, let alone trying to help other people in their countries.
Yeah.
And on the other hand, there is the fact that viruses have no borders.
Yeah.
Pandemics have no borders. Yeah?
Yeah.
So you may not have it now, but how often do you travel? There's globalization, which means you're likely to contract diseases from other countries that may not be prominent in your own space, which means it is everyone's concern. The moment we leave one person behind, everyone else gets affected.
Mm-hmm.
So let's stop this whole like, oh, I'm only caring for my own citizens. I'm a national citizen, blah blah blah. We are global citizens at the end of the day. So whatever happens in neighboring countries, or even in countries that may be across the continents or in a different continent to you, it's gonna catch up to you eventually. So yeah, but just to add on to that, sorry, I'm just gonna
Yeah.
have more. To add on to that, funding as well needs to come from somewhere,
Yes.
right?
Yeah.
So it's like, yes, we want to fund it, but we need resources to fund these programs. But where's the money gonna come from?
Yeah. So here's my thing, right? I feel like to some extent it can be justified to take that funding. Especially like you're saying, to your point, that you have your own problems that you're dealing with domestically and at home.
Yeah.
So why are you now also taking a huge amount of money, like in the US's case, like billions of dollars,
Yeah.
and throwing them
Yeah.
to overseas countries?
Yeah.
But then and yeah, I was also thinking in terms of, let's say, PEPFAR, which was set up like 20 plus years ago.
Yeah.
It wasn't set up to be a permanent fund. It was an emergency fund. You know what I mean? For the problem that was there and then.
Yeah.
But now it's almost like it's almost like meant to be there. That was never the plan. It was never meant to be permanent. So to me, at some point, a lot of countries that were receiving that aid should have like started to work towards being able to finance their own programs.
Yeah.
Over the past 20 years, for example. On the other hand, like we're saying, people do need resources and the money does need to come from somewhere. And when we look at how these countries became so dependent on AIDS, it is because you colonized them. It is because you got on your boats.
Oh, no one asked
you
you to.
sailed the seas.
No one asked you to
the
do that.
choppy seas.
Oh.
Some people didn't even make it across the sea. But you made it and you said, we'll colonize, we'll claim this land, and we'll take all their resources.
Took the resources.
So I also think to some extent it's unfair to now all of a sudden say, oh, we're backing out, we're washing our hands of this situation and just focusing on our own problems. Again, to your point, the US is still part of the world. They can't just operate in isolation. We do need global cooperation at the end of the day.
Yes, and you never know, it might be you tomorrow.
Ooh.
Oh, sorry.
Ooh.
Sorry. Who said that?
Who said that? Who said that?
And back to this point about funding, like they say, they cut the funding. Is it because of lack of money? Because I know the sister, the United Kingdom, the puppet. No. I mean the sister. Sorry.
She said puppet. Did y'all catch that? She said puppet.
The sister, she also cut funding towards foreign aid, and this funding went from one state to another, one department to another. So I saw in the news just last month that there was a cut for foreign aid funding that went down it was taken away by 40% and taken into military funding. This is from the BBC News, by the way. So yeah. So is it really lack of money? Is it lack of money? Is it lack of willingness? Is it lack of different priorities? Yeah. Like the famous, is it Bill Gates that said it? I don't know who said it, but show me your budget and I'll show you what you value.
No, that's a very solid point. Because if you ask me, in an economic crisis and I'm trying to find money to fund my stuff domestically, I might start with maybe, not funding wars.
Maybe not
bombing other people's countries.
Yes.
Not sending my drones.
I'll say, it's protection. Protection from who?
Protection from whom?
And from what?
From what? But yeah. I mean, if you were to ask me in general, I do feel like for the longest of time, the way we fund global health has kind of been flawed. I don't think it's very normal that a sovereign independent country should be so reliant on another country's money.
No.
And to me, it's just another form of colonialism. It's just neo-colonialism in another form.
Remixed, spiced up,
a little bit of ginger. Because at the end of the day, the moment you accept money from these foreign donors, you also now need to accept that you are prioritizing their priorities.
Yeah.
They set the agenda.
They said, oof.
They set the agenda.
They set the agenda.
And I forget the name of what it's called in the US, but they kind of have this law where any countries where they give their foreign aid, they cannot use that aid to fund any services related to abortion, for example. So even whether you're a country, whether you're an NGO, the moment you accept money from the USA, you cannot even use it for such services.
There are rules.
It's their rules. Their money, their rules. At the end of the day.
Yeah.
So yeah. I mean, that's I guess my main thoughts.
Yeah. There's a lot to consider.
Yeah.
It's a lot to consider. But global health right now, maybe if you're working in global health and you're also a little anxious, maybe consider other sources of income. Start that side hustle, babes.
Start a side hustle. I mean, it's looking like different countries need to find side hustles.
Yeah.
Because how else, as a corrupt politician, are you meant to fund your private jet? How else, as a corrupt politician, are you meant to fund your wife's Gucci addiction? We need to be very considerate.
She went there.
We need to be very considerate.
If you're not a politician, it does not concern you.
You know who you are.
We know who you are. I know some of you will start coming for us. This is about the politicians.
Yeah. But yeah, I mean, we'll look into a little bit about how we can, rethink financing global health. But yeah. So we've looked into how everything unfolded. We've looked a little bit into how global health is funding and the US's role.
Yeah.
But what now? What's the path forward? Where do we go from here? Because let's be real. This isn't the first time that aid has been cut like this, and it probably won't be the last time.
And right now, there's growing momentum, or let's say there's this thing for something different. More funding through regional organizations, more domestic financing, and more autonomy for low and middle income countries.
Some people, basically me, are talking about global health reparations.
Yeah.
Like, what if instead of just aid, we called it what it is? Redistributing wealth after centuries of extraction.
Oh, she's been saying it, y'all.
I've been saying it.
Say it louder for the people in the back.
I will say it today. I'll say it tomorrow. I'll say it in 100 years. So, of course, none of this can change overnight. And I do feel like this whole global health aid freeze has been a wake-up call.
Yeah, and maybe it's time we spend less time building a system, not just on vibes, but also making sure that politicians are not deciding what's happening in a different continent from miles away.
From over there across the Atlantic.
Across the Atlantic Ocean.
It doesn't make sense. So, what can actually be done better? Because cutting foreign aid is not new, like we said, and the answer isn't just send more money and hope for the best.
Exactly. For example, a lot of African countries are stuck in this foreign aid hamster wheel, constantly running but not really moving forward because their priorities are often set by whoever has the money. That's why you see entire programs built around just one disease, while other health needs get lost in the dust.
So maybe step number 1, we need to build from inside out. Governments need to put more of their own budgets into health so they're not dependent on outside aid. So that means diversifying where your money is actually coming from so you can set your own priorities.
Speak on it. Step 2, link up and level up. We need more private partnerships regionally and as well as teamwork. So you're not waiting on a shipment from halfway across the world to get basic medicines and supplies.
And finally, use big money tools. We're talking about things like development finance institutions. Yes, they're very helpful for giant infrastructure projects, but they can also help when it comes to funding health systems. And they may even be a more sustainable way to do that long term.
And basically, please help us, and more of, if you want to invest in this, here is how. So taking more ownership of our own health systems in each individual country.
Yes, that's the energy we want to see. More energy, more passion, more energy, more passion. Yeah.
Energy, hey, energy, ha.
Anyway, guys.
Thanks so much for listening to this episode. Remember,
Yeah.
please, to like and share and subscribe so you can help us grow our channel, our small channel that we've been trying to grow.
I mean, we continue growing.
Yes.
Please continue to follow us. You can find us on all our socials at WHI_podcast, Twitter, Facebook, and what's that one? Instagram. You can find us
TikTok,
there.
everywhere.
LinkedIn. You can find us everywhere, even where you get your podcast. We'll be there.
Please make sure to leave a comment. And please make sure to leave a like. Please do not let us down.
No.
Please see you next week.
Bye.